Okay, so now we go with the first presenter, Mr. and future Dr. Greg Cohen. Go ahead, Greg. Greg, you are mute. You're mute, Greg. I can unmute.
There we go. Sorry about that. Okay, so everyone can see my screen, correct?
Yes.
Okay, perfect. So my applied practice, I have a lot of kind of documents. I'm going to show you what I used. Mine was, I actually traveled to North Carolina and worked with a underserved community, and I led basically a health promotion program related to lifestyle change as it pertained to hypertension and obesity. I was part of the Randall Health Lewis Fellowship program, and through my connections there, I got put into touch with Faith Health, which is part of Atrium and Wake Forest Baptist, which is a large healthcare organization down in North Carolina. And through working with Faith Health, we targeted the Union Baptist Church, which is in Lexington, in North Carolina. And like I said, I flew out to North Carolina at the end of the summer, and I presented this program. And a lot of it took into account a lot of what through the DRPH and even the master's program with lifestyle management that I was able to use to create this program. I'm just going to kind of jump through some of the slides real quick. I included a little bit of scripture because obviously I was dealing with a church community, a Baptist church. So I wanted to show a little bit of a connection between faith and scripture, along with how we should be taking care of our health and food and what scripture says about that. I tried to make the presentation very interactive among the community. There was about 20 to 25 congregants that showed up. And one of the ways that we incentivized them to show is there was food involved as well. I will show you. So I have a culinary background. So I created a bunch of recipes, and we actually cooked the food. The people, some of the parishioners in their organization created or cooked the food, and we served it as part of the education. And what I tried to do was take my culinary background and infuse the lifestyle component and health component to what I made. So I took a lot of the traditional foods that people eat in the South and tried to create a healthy spin on them. So I created a watermelon, cucumber, and basil salad for them. We also did a coleslaw that was vinegar-based instead of mayonnaise-based. I did a barbecue sauce that eliminated straight up sugar, but used sugar substitutes such as maple syrup. And then I took collard greens, which is a big staple in the community. And instead of making them unhealthy, we made a sweet potato hash so that they got a good amount of carbohydrates and healthy fats and things like that. And then the main part was, and I don't have a picture for this, sorry, was blackened chicken. So instead of doing fried chicken, which is the traditional way in which people have chicken in the area, which I learned too, not only from doing my research, but just talking to congregants, is every time they do something at the church, there's always fried chicken. So we made a blackened chicken along with the barbecue sauce and served that as a meal during which I gave the presentation. To include some of the other things such as the lifestyle and the health coaching component, which I passed the National Board Certification for Health and Wellness Coaching. We talked about their readiness for change and how willing they are to make changes or how confident they are. And then we had a little discussion about the pros and cons of making changes. And as we know, a lot of people say time is a factor when it comes to a con to make changes, as well as other people in their household not wanting to eat in a healthy manner. But then some of the pros, for example, were the fact that people knew that they needed to change. Otherwise, they weren't going to live very long, or that their health was going to be severely compromised. So I created the goals, and some of this was actually derived from the class that I took with Dr. Polani, his nutrition and education class. And I had goals that I set out to achieve, hopefully by the end of the session, which was to increase the number of healthy foods such as fruits and vegetables, and at the same time reducing the intake of energy dense foods and sugar sweetened beverages. Something to note is the primary drink of choice at the church when they do these events, aside from soda, is sweet tea, which, if you know, sweet tea has a tremendous amount of sugar in it. So we only allowed water during this. And I was worried we'd have a lot of pushback from the congregants, but they actually enjoyed the meal. At least that's what I was told. And then ideally, the second goal was to build confidence in making lifestyle behavior changes part of their daily practice. I created this little acronym called PILL, which is proactive and living longer. And I use the idea of CPR in the fact that if they saw someone in the church or somewhere on the street that needed life-saving attention, would they stop and do that for that person? And overwhelmingly, everyone said yes. And then I said, so why would they not help themselves? That was kind of the idea behind it, using the CPR analogy. I went through some facts based on things from the CDC and the WHO, gave them some other statistics. We didn't spend a lot of time on this because based on the education level of the church congregants, I didn't want to focus too much, but I highlighted some important things about obesity and hypertension, especially in the community being a large Black and African-American population. I explained what hypertension is and making sure that they knew, especially if they've gone to their doctor, the risks associated with being obese, BMI ranges and weight circumference. Like I said, we didn't spend too much time on this, but just a general overview. And then we went into really how to eat for healthy living. I found a YouTube video from a doctor at Cleveland Clinic. And the best part of it was when we talk about cultural awareness, making sure that it fit the demographic. So the doctor is African-American who speaks in this video. And I thought it was better to use that than your typical, than finding someone who was necessarily white or didn't necessarily, resonate with the community. So I tried to be as focused as I could with cultural sensitivity and cultural awareness. And I also, with the people that I conversed with before running the program, that helped me as well. We talked about what to eat to improve health, such as fruits and vegetables, legumes, fish, whole grains. And then I went through each kind of food group and what they do and their benefits, fruits and vegetables, fish and lean proteins, what to choose when it came to fish and lean proteins, whole grains and what they can do, such as lowering blood pressure, aiding in digestion, healthy fats, and then obviously saying no to sugar because sugar is not good for us. We stuck on this for a little bit. And then I gave them a little activity. So as part of this, as I go to my other document, which I don't know where it went, I'll find it one second. So there was a worksheet that I used for them where they could fill out the ruler for how confident they were in making a lifestyle change. And then I had them calculate what 5 to 10% of weight loss was so that it was easily understood for them, so that it would help them understand that, oh, I don't need to lose 100 pounds necessarily. I only need to lose 15 pounds, which is an easier goal to obtain than seeing a big number like 100, for example. And then we talked about tips for making change possible, such as measuring their food, keeping a food journal, limiting saturated fats, limiting time eating and snacking while watching TV. And I didn't just throw these slides up on the screen. A lot of it was interactive prior to me showing them some of these bullet points so that it was more of a conversation than me just lecturing at them. And then I briefly discussed 2 diets, the DASH diet and the Mediterranean diet, as forms of healthy eating. In order to see if anything changed throughout the hour-long time that we had together in 90 minutes, I put another readiness for change, or how likely they were to change their mind. And I asked them to kind of rate themselves based on the beginning of the presentation to the end of the presentation. After that, when I got back to LA, I sent the people who I was in touch with, the pastor of the church, the community leader, a questionnaire on SurveyMonkey to fill out, how kind of a post hoc analysis, if you will, or just to see how well I could evaluate my program. So I had them fill out a questionnaire and it was resoundingly positive. The only thing that they wished is that they could do these more often. And then secondly, I just want to make sure I'm good on time still. Cool. There was a second part where I did the train the trainer. So basically all of the Faith Health has a large network of churches that are within it. I think it's about 30 to 40 churches within Faith Health. which is part of the Raeann Baptist Association, which is part of Wake Forest and Atrium Health. And so the second day that I was out in North Carolina, all of the church leaders that are involved in their health promotion or trying to work on improving health, we basically went through a similar presentation, but more based on how they can lead a successful program. So some of the slides that you'll see are similar to what we did in the first presentation. I included the Wheel of Life here so that if they ever talk to a congregant, they can get an idea of maybe where someone is in their life, why they're eating poorly or they have poor lifestyle behaviors. And then we really talked about how to lead a successful program, about setting goals and objectives, because I won't be there all the time. And these are the people on the ground doing the work. The goals, and then we just kept going on and talking about the 4 E's. And this is something I remembered from Dr. Polani's nutrition class, is just really how to get people involved by exciting them, explaining to them what's going on, expanding by giving practice and behavioral skills, and then exiting with a goal setting skill so that they can apply. So these are all of similar things that I already covered. The other thing we talked about were helpful tips, and this also was very interactive. This section was done via Zoom because the church organizations are spread out throughout North Carolina, so they all couldn't come to Lexington. So we did this on Zoom, but we talked about how they can lead these successful programs by, understanding their population or their church community, giving them homework assignments to do related to their goals and behaviors, and then how to help people manage setbacks if they do decide to pick up new nutrition skills or physical activity skills. And then I left them with some quotes for the day. Most importantly, the other thing, really what I did also as a gesture, I have a lot of organizations or businesses that I work with, and I got them to donate product so that I could raffle it away as another incentive for them or to get them going on their fitness or health journey. So I raffled away 2 pairs of running sneakers and some clothing, so that when it got a little cooler, they had a nice jacket to go out for a walk in or something like that, and left them with all of the recipes. I wanted to show you this as well. This was the flyer for the Train the Trainer program. I made a flyer for both events. The Train the Trainer was on Thursday. The one for the congregants was on Wednesday. But I created these flyers just for them to email out to the other churches or within that church itself. For the Union Baptist Church, they emailed the flyer out to all the congregants to let them know that we were doing this event. So basically what I took away, I think it was actually really great that I went to North Carolina, because I don't know how else I would have done this, because I could have done it over Zoom, but it didn't have the same impact. I literally got to shake hands with people, had great conversations with the congregants, as well as those church leaders or the trainers, so to speak, from the other churches. And it really was, it was inspiring for me to actually be able to do this for the first time, because I have limited experience doing this type of presentation. But it was really rewarding, and I got to use a lot of the different things that I've learned throughout this program as well as the masters. So that's everything for me. You're muted, Dr. Dos Santos.
Great presentation and great program. And is Northern Carolina also included in the southern states or not?
Yeah, it's part of the South. I think if you get a little bit, it's more central South, but it's categorized when you look at data from different organizations like the CDC and things like that. It falls in the pocket of the South where there's high incidences of obesity and hypertension and things like that.
So they have the same culture with chimichangas and everything fried and things like that, deep fried.
Yeah. High in saturated fat, deep fried, and a lot of sugar. Yeah.
So I wonder, how was the reception with the trainers? I mean, were they open? Were they? Because
Yeah.
I understand. I guess all of them were blacks. Is that right?
Yes, everyone that was. I think there was one person who was white on the, so we didn't have everyone from all 30 or 35 churches show up. There was about 8 people. Still, the reverend who's in charge of that whole group, we recorded the session for them to have, but yeah, it was mostly minorities, but they were all very receptive because these are people that had volunteered or were picked who really want to help improve the health of their churches and their communities. So they were very receptive to it. And I had a woman who was Latina as well on the call, who asked a lot of great questions and was very interactive in it.
Very good, very good, very good. Anybody else has a question? We still have 2 minutes for Greg.
It was a great presentation. I don't have any questions, but maybe I'll get your contact information to see how you did it, because I'm starting my dissertation.
Yeah, no, I'm happy to give you out my information. Just feel free to email me or ask Dr. Dos Santos.
Thank you so much.
Okay, thank you very much, Greg. Excellent work. And that's one type of activity for the other students that preventive care should be involved in, and for the applied practice is wonderful to be in such a position. And this is mostly what we did in Dresden and the areas around here. Maybe you did much deeper. I appreciate that culinary part. That was exciting to have.
Yeah, that was fun. I got to use skills that I've already had and also try to do something that was out of the box, especially for a community like this.
Thank you, thank you, thank you. Now we go with Raeann. So you have to unmute yourself, Raeann. Raeann, you are still mute. Let's see if I can unmute.
Me now?
Yeah, good.
Okay, great. Okay, so hello everyone. I'm going to share a little bit about my applied practice and what I was able to do. My applied practice was focused on health behaviors and chronic diseases, using health coaching and motivational interviewing to meet with clients. So let me just go to the next one. So basically the health coaching was part of an initiative through the Lifestyle and Preventative Medicine Clinic at Loma University. So the public health issue that my applied practice addressed was chronic diseases. So the patients that I was able to see either, had heart disease, some of them, had a stroke, many had diabetes, or even kidney disease. So there was a variety of patients that I was able to see. So that was kind of the subset of the population that I was focusing on. So again, the Preventive Care Clinic, we looked at the Intensive Therapeutic Lifestyle Change Program. So it was a skill-based competency program that these clients had gone through. So it was an intensive program that they were addressing their chronic disease with. And so afterwards, there is a follow-up, because we all know like behavioral change doesn't just happen in one event. So my task was to work with the clients after they completed this intensive program through the Lifestyle Medicine Clinic, and work with them and see where they were after, the intensive program. So, the way I looked at it when I started my clients is I didn't pay attention to the history that they had with the intensive program. I was able to start an initial health coaching session and, kind of feel where they were, which areas of behavioral change they were most interested in focusing on, just to get to know them, because as a health coach, we should be able to be active listeners and listen to the patient's history, whether it's, their physical activity, their nutrition, their diet, their stress levels, their sleep, all of those things that relate to chronic lifestyle conditions. So I got to work with that. It was in collaboration with the School of Medicine, as it was a few of the preventive medicine residents that I worked with on the project, as well as the clinic and the School of Public Health. I got to work with Dr. Wilson, and name is escaping me. It's been already a great time afterwards. So anyways, I was able to do, let's see here, I went too forward. Another portion of the practicum was to work with the ITLC curriculum, which was the therapeutic intensive program that these clients had gone through. And so what I did was I looked at their Health 180 curriculum PowerPoints, and I was able to enhance them and standardize them because they had many different presenters for each session. So I just went through and I adjusted their PowerPoints. I was able to make figures and work on those things. So let me see what else on methodology. Yeah, so for methodology, just again, focusing on health coaching, we focus on the client's self-determined goals. Are those goals achievable? Are they attainable? Because a lot of the comments that I heard from the clients were, I just came from this intense program and I'm so overwhelmed. They told me to change so many things and I don't think I can do that. I've already, reverted back to what I was doing before the program. So we were able to reevaluate their situation, and I was able to talk with them and say, well, what is the area that is, most concerned to you, and how can we make a small goal that will be able to be maintained throughout a lifestyle, not just an event. So I was really, really excited to use my health coaching skills in a tangible way. When you're in a classroom and you're learning it from a textbook, you're like, how does this actually work? And so I developed a really great rapport with my clients, and a lot of them were really so sad to end the sessions. So I have specifically, one of my clients had a great amount of success. He, in the beginning, felt very unmotivated. And so I think a few of the sessions we started out with just speaking, about, what are the barriers to his goal? What are the barriers to his goal, and what worked for him in the past? And the final session, he was able to say that, he was motivated and he believed that he could continue doing the behavioral changes that we had discussed throughout the sessions. So again, here's just a slide of the summary of what I did for each client session. Again, setting the foundation was the initial client session, and I got to keep detailed notes, and I provided these with for Dr. Wilson on an Excel spreadsheet just for each session on what we talked about. And at the very end, I went through and I connected the theme. Okay, so in the initial coaching session, did we talk about that throughout? Was there a change in it? And did we meet that goal at the very end of the session? So that was really interesting to see. Some, take more time to reach a goal, and some of them were just deciding, hey, okay, this is a possibility for what I'm going to work on with my behavioral change, for my, high blood pressure or my diabetes. So that was really, really great to see. Let's see here. Yeah. So I would meet with my clients every week. There were 30-minute sessions. And I would also, there was majority of the clients would attend regularly. They looked forward to the sessions. There was a few that I had to reschedule, but they were excited to reschedule because they didn't want to miss a client session. So that's positive feedback, right? They were, excited and motivated to continue health coaching. So I did talk a little bit about some of the health coaching summaries that I had with each client. Let's see, what else do we have here? Okay, yeah. So again, this is back to the 80 ITLC. So over 40 slides per per session. So I completed 9 of these curriculum based, and again, the goal was to make it a standardized curriculum that they're going to continue to use for the lifestyle medicine clinic at Loma. So it was great to work with them. Here's just an example of one of the figures that I made. So it was good to be able to make visualizations that were effective for their presentations. So before I end, I just want to say that this applied practice was definitely a collaboration, and I love seeing how public health and preventive care, preventive medicine and lifestyle medicine were able to, work together and serve the clients and patients that we had for the summertime. And I definitely do see that as a marketable career path and a marketable intervention that clinics can use, because these patients did really appreciate the assistance with behavioral change. Many of them wanted to continue doing health coaching, but again, like after I finished my applied practice, I wasn't sure, down the line who was going to take over for that. I know that they still wanted to continue doing it. But anyways, so as, a doctoral student in public health and specifically chronic lifestyle diseases, I was able to actively see how my skills would be used in just one aspect. So it was a great experience overall. If you have any questions, please feel free to ask me. Thank you for listening, and wish you all the best.
Great. This is preventive care. I mean, this is preventive care essentially, and health coaching. That's what I was going to add to that. Very good. For your experience. I mean, you have done. Raeann has done all that you can imagine. She was working with me in Dresden and did all sorts of health fairs and assessments. And she started the Loma Linda Light, that is one of our programs for weight management that we won, promoting the church. By the way, I'm waiting for your files. Don't forget that. But she has done all of these, and now this was a culminating activity, showing her experience with health coaching. That was great. Any of you have a question for Raeann? We have plenty of time.
I have one. So for the health coaching, do you have any tips or ideas on like where should we be like focusing more in when we are talking to somebody?
Okay, so I think as a health coach, you have to think about the background. Where is your patient demographics, patient population? So I knew ahead of time that my patients had just gone through an intensive program. So when I started my initial session, I wanted to hear more of what they had to say, because I know that they had received, health education, public health materials. They probably had information overload. And after, right after a program, I think I had them, I don't know how many months after it was, but it was during the summertime. And I think we had a class that was like the winter and then the spring, I think. So there was a little gap. So they had time to process the information and try to, make actions on those changes. So I knew that there was going to be probably some that were like, oh, I already fell back into what I was before the program, or some were probably struggling through it. So I would say the initial coaching session kind of sets the scene and sets the direction where you're going to be going. And you'll be able to tell, because each of my client was at a different level. One was just doing really great, on track. The other one was just confused. The other one was discouraged. And one of them, I had to really try to like meet with them, you know, because they were just like, oh, I can't meet this time and this time. And so, but when I finally met with them, they had so much to say. And then by the third session, we started, you know, focusing in on, okay, the first session was, okay, where are you at right now? And some of them would feel overwhelmed. So you don't even really want to set goals until you establish an understanding with the client. So I would say, you know, you just use your motivation interviewing techniques and skills, active listening, repeating back what summarizing, you know, open-ended questions, because the client's going to tell you what they need and what they want. And then you can understand, you know, what resources or barriers they have. So I say, you know, it's something that can't necessarily be taught like you have the tools, but when you start doing it, you'll start seeing yourself like, okay, I'm listening to this client and, you know, I'm going to have to use this technique compared to the next. So I would say that's my best advice, and practice. So I don't know.
Oh, thank you so much. Thank you. Yeah, so right now I am volunteering at the Teslyn Center, and people, when they come and see and do the in-body, when I do the explaining of the results, they have so many questions, and instead of like only the 3 minutes, I end up like talking like 45 minutes with each one of them. But I just wanted like a little bit more on what you were doing with your clients, so I can have better open-ended questions and not to like fix the problem right away, you know.
Exactly. One other thing, like I thought 30 minutes, I'm like, oh my goodness, there's so much things to talk about. But if you really structure your session, you can get it done, and you can also get it done without the client feeling like you are rushing, because you know, if you think about it, 30 minutes isn't that long, but it can be used efficiently. So I had to figure that out too, because I was like, oh my goodness, I have to keep going fast, but it doesn't have to be like that, because, you know, and also it allows the client to develop their self-determined goal. Like you don't want to push something, you know, because then it's your idea and not theirs. So
yeah. Oh, thank you so much. Thank you. I appreciate it.
One important thing here is that the position of a health coach on a team, and this is very interesting. You can imagine how the client will move without a health coaching, and how the client will move with a health coaching is completely additional, completely perfect combination when you have a program and then you get the health coach individually with the client. Thank you, Raeann. Any other question? No? So we jump then to Teslyn. Teslyn, go ahead. It's your turn now.
Okay, thank you for that. Let me get this screen shared. Okay, can everybody see that?
Yes.
Okay, well, good afternoon, everyone. My name is Teslyn Henry King, and as Dr. DeSantos shared, I am a registered dietitian. I oversee the nutrition program for San Bernardino County Department of Public Health. And I completed my applied practice experience over the summer quarter. And it was really a true opportunity to integrate and apply the theory that we've been learning throughout our whole preventive care program into practice in a real world setting, and to take a project of your choosing, really from conception all the way through completion. So because of my interest in individual personal health, planetary health, low income and minority populations, and how all of that intersects, my applied practice experience was a little different from that of Greg and Raeann, in that what I did was to design an applied practice that allowed me to dig further into that. And so I will share briefly what I did and what I found. So I have experience doing programs and implementing programs. So I wanted to get a little more experience doing things related to qualitative research, which I really haven't done much before. So this was a way to kind of test those waters and stretch myself, so to speak. Now, diet and physical health are linked, as are diet and environmental health. And imbalanced diets really increase disease burden, just as food choices actually impact the health of the planet and contribute to climate change. And there's data that does suggest that those in low income and minority communities are really quite vulnerable to the impacts of climate change, yet those voices may not necessarily be included in some of the work that's out there. So my applied practice was qualitative in nature, and I was trying to kind of explore from the perspective of the African-American community what their thoughts and ideas were around these concepts. So I conducted focus groups and interviews with African-American participants in order to understand their perceptions of climate change, their personal health, and environmental health. And I really aimed to try and assess individuals' knowledge, their personal values, their perceptions, and beliefs related to this intersect. And I was also interested in their visceral reaction and thoughts about educational tools, and a new tool that has potential. It's developed by Dr. Sabate. It's the Carbon Footprint and Health Effects Matrix. And I wanted to see if just by seeing this, if their reaction was such that it could be of value. So I developed a semi-structured focus group, an interview guide that I used throughout this time period to conduct 2 focus group sessions, 2 small focus groups, and individual interviews with a total of 10 community members. And this was done in August of this year. The focus group and interviews were designed to ascertain, they were designed to really try and understand person's thoughts, their knowledge about climate change, impacts that they have observed in the environment related to these things, the groups that they perceive to be most at risk, and to try and see if there was anything that they perceived could be done about this, what that might look like, and if there was actual impact of dietary choices on health and the environment. And I wanted to see what their level of concern for all of this was, in addition to testing out that new tool. So I had specific questions, and one was trying to understand, do participants connect their dietary choices to their personal health? And then do participants also connect dietary choices to the health of the environment? Then I also wanted to see if, when introduced to this new tool, the Carbon Footprint and Health Effects Matrix, if it was something that they understood just by looking at it, if it was understood as intended. And then lastly, do they perceive the tool to be something of value that they could potentially use in shifting their own health behaviors towards greater environmentally friendly type of health promoting dietary choices? So in terms of the 10 participants, they were recruited from San Bernardino County Department of Public Health, any persons who participated in any of the healthy eating, active living classes that took place in federal fiscal year 22. They did not have to complete the series of classes. I was just interested in tapping into some African Americans who I could interview and have focus groups with. They were also given materials and resources to invite others within their community and circles to join. And what I found in our 10 participants was that there was a really good, diverse type of group. They were all adults, all over 18 years of age. There were 4 persons between 18 to 35, 3 persons who were 36 to 60, and then the last 3 were over 61 years of age. They all identified as African Americans. Those 3 also identified as either Hispanic, Latino, Indian, Alaska Native, or white. And then we had 6 females and 4 males who actually participated. As pertains to education and income, I didn't test for income specifically. I didn't ask any questions demographically around that, but I did ask about employment. And so most were employed, 2 were employed full-time, 4 part-time, 1 self-employed, and then 3 were retired persons. And they had a wide swath of educational experiences. 1 person had less than high school, 2 completed high school, 2 had associate degrees, 3 had bachelor's, and 2 had master's degrees. So we had a wide spectrum. Most were married, 5 of them were married, and the other 3 were single and 2 were divorced or widowed. And I was curious as to how they identified and type of eating pattern that they were currently employing in their life. And 7 were omnivores, 2 identified as vegetarian, and 1 identified as a vegan. So I did the 2 focus groups, and they took about 60 minutes each to complete. And the individual interviews would range from 30 to 45 minutes in length. The interviews and focus groups were done primarily through Zoom, though 2 interviews were done by phone and 1 in person. And then I took the transcripts of all of those conversations and interviews, wrote them out, and then looked through them all, combed through to try and see what were some of the themes that were reoccurring in all of those conversations. And so what I found in terms of climate change was that most participants actually do see evidence of climate change, and they're concerned about it. And more women were concerned than men. The participants were able to talk about climate change in terms of significant changes in average weather conditions. And 1 person commented, for example, I know it's happening because, I mean, it's hot and it's hot. It's not normal. It's hot, hot all the time. The weather is bipolar, is what they said. Most of the individuals, participants, did feel that low income and Black and Brown communities were at greatest impact for climate change. And they were kind of split as to what could be done about it, with some persons who were focusing solely on things external to themselves, like the government needed to make a change. So 1 person said, things we can do, things we can do to reduce it, meaning climate change, is to have our legislature put funding in for it, to fix it. They know what to do in order to fix it, but we have legislation that deny and keep it the same. And then we had others who kind of had a sense of personal responsibility, but they were thinking in terms of things like cars as pollutants, recycling and being involved in that, reducing their use of plastics and not littering. They weren't thinking in terms of diet. So 1 person said, what we can do is maybe have days, when we celebrate. For example, we have Earth Day and public transportation, like the Metrolink is free on that day. So can we maybe do that once a quarter where we encourage people to do public transportation? So as relates to diet and health, all of the participants clearly do believe that dietary choices impact their health and health outcomes, and they all really did express concern for their own personal health. Thoughts about the best diet for health varied widely. And for example, 1 person said, I'm a fan of color. I have most the variety of color as possible. I eat chicken and meat, so add some additional health to it. That's where I am. So interestingly enough, when it came to diet and planetary health, this was something that most of the participants had really never given any thought to. The connection between diet and the environment was not really clear whatsoever. And they were really less concerned about the environment than they were about their own personal health. So when asked if they believed that their dietary choices had an impact on the environment, participants did admit that they really had not thought about this, indicating that the relevance to them was really, really limited. And since it was the first time that many were introduced to the concept, they thought it was something interesting to consider. One person was saying, it's an interesting question. If I'm throwing stuff out of my car window when I'm eating and driving, then yeah, meaning that has an impact, but I haven't really thought about it, was kind of where they landed. So in terms of educational tools and ways to kind of move people along the spectrum towards thinking about this and hopefully making dietary behavior change, I asked questions about my plate as a tool to try and understand if this was something that they had used, they understood when they looked at it. And when it came to my plate, most persons, 80%, had seen my plate, and persons really didn't admit to using it per se. It was not something that they regularly referenced when eating or making food choices. But they did understand it when they looked at it. One person said, for example, it instructs me to have a meal that has more than just meat and potatoes. So the new tool, the carbon footprint and health effects matrix, I simply showed to people. There was no education, just kind of wanted to see what their gut reaction was to this. And when they did see it, right off the bat, persons did see color coding, and they got the concept and made the connections of red, yellow, green to traffic light signals. But then there was some confusion as to the various shades within the green and the red, for example, and what that meant. And then from the carnivores in particular, when they looked at the tool, the impression that they got and what they took away was eating meat is bad and negative, that they were only to focus on fruits, vegetables, beans, legumes, etc. And so that immediately, I believe, turned them off, and they had little confidence that the tool would be of value in shifting their behaviors. But one participant did look at the tool and understand it as it was intended. And that person commented, wow, this is interesting. I feel like this helps to give me more strategy and making a different connection with food, not just a personal level, but thinking about food at a higher level. It makes me think about food choices in a way I never have, in a good way. So as there is little data at the intersect of African Americans, climate change, personal health, environmental health, and those types of issues, these results were interesting for me, and it helps to provide some perspective as to the unique insights and the beliefs and values and perceptions of persons in the African American community. Of course, it's a very small study, but it does help to understand at least just the tip of the iceberg, so to speak, because there's so much more that needs to be explored. And that's what I'm hoping to do in my research, and to put into practice some of the things that I took away from this. And speaking to those 10 participants was in designing the educational pieces that go along with this, and working to implement that. It definitely needs to be such that it focuses on personal health, even more so than environmental health, and makes that connection clear, since that's the space where people are in. And that it really comes from a place of non-judgment. The tool doesn't say you need to eat one way or the other, but that was what people perceived when they looked at it. So making sure that persons understand exactly what the tool means and what it's saying, and they can be able to apply it and use it as a guide to hopefully move people in the direction of eating those foods that are definitely more environmentally friendly, as well as healthy and life-sustaining. So that's just a quick overview of what I did. There are a lot of different ways in which you can use your applied practice, and I hope that gave you insight into maybe something different that you can do when it comes time for you to do your applied practice experience. Any questions?
Thank you very much. That was really exciting. So I am a little bit guilty of those because for a while I was trying to find a champion that would be able to work with Dr. Sabate and preventive care on this issue. And praise the Lord that Teslyn got it, and we are excited for you, Teslyn. Thank you very much. I mean, this is something. Any questions from the other guys? It is something that so you see the variety of things. So talking now to the other students that will need to do this, you see how many things, different things you can do. You can work individually, you can work in a group setting, you can do a small research as Teslyn did, and there are several other things that we can do in preventive care to apply some of the skills you got in the program, and then to help the communities and to help people to go in a positive direction in terms of lifestyle. So I appreciate you the three of you, to share that. In fact, this was the first time that we designed this setting in the Preventive Care Grand Rounds to show what people have done. And then we will continue. From now on, every time you finish your applied practice, you have to come right here and share with us what you have done. And we are going to record that. So thank you very much. So we still have 6 minutes. Any comments, any questions, any take home messages?
I just wanted to echo what Dr. Dos Santos said. I liked all the project. They were very different. They were very unique. So I just wanted to say good job to all of the students that presented today. So it was very good.
Thank you, Mike. Thank you, Dr. Paulani. Sorry. Michael was my student, and then I'm still asking him to call me Hildemar, and I'm still having a hard time to call him Dr. Paulani.
That's okay.
How many of you, of the three of you, are really into continue and build up something on what you did? Is this something that you consider? I know Teslyn will say yes, because can you work out a little bit on that, Teslyn? What you are gonna do from now on this?
So I'm using this as information to help guide my research project, where I want to continue to explore this intersect within the African-American community and develop educational pieces that can go along with the tool that Dr. Sabate has developed, and implement that in the community and kind of test and see if that will indeed help to move people along the spectrum of change and move towards a plant-friendly, healthy diet. So it continues, it definitely continues. I'm also excited about actually tying some of this stuff into the work that we're doing at the county, because even though we do a lot of nutrition education, there really isn't any education around impact on environment and climate. And so I'm looking forward to kind of integrating that into our work and our education as well.
Thank you. We have a question here for you. Maybe Abrar can talk to Raeann. There is a question about share the slide decks for the ITLC 180 program. But I think you guys can communicate with each other on that. Anybody else? Okay, so we will finish now. I appreciate the presence of the other guys, and I appreciate your presentations. So it's an honor to have such kind of students in our program, I'll tell you. Very well done. Very well done. Take care of all of you. Bye-bye. Bye-bye.